Good afternoon. Welcome to Grand Rounds today. Please remember to sign the attendance record at the back of the auditorium. And also, please remember to fill out the program evaluations. And if you can give us ideas in regards to future topics and future speakers, we're always appreciative. Today, I have the pleasure of introducing Sue Knapp. Ms. Knapp is a registered and licensed occupational therapist, and she is also a certified driver rehabilitation specialist. She currently is on the staff at Yonker Rehabilitation in Des Moines, where she's an occupational therapist, and also where she specializes in driver evaluations. And she has kindly accepted our invitation to drive up today and provide us with some education on issues with the older driver, health decline, dementia, and Alzheimer's. And please join me in welcoming Sue Knapp.
Thank you. Thank you. Well, I've got to say, I haven't been to Mary Greeley for a long time. I belong to the OT Association. We used to have meetings here, but I don't recall your facility is lovely. I haven't been here probably in about 20 years, so I'm very, very much impressed. Just to kind of get an idea who's in the audience, physicians, who are all physicians, therapists, nurses, dietary, I don't know who else. I'm not sure. Social workers, volunteers. Good. Well, welcome. Just to get a little background about myself, I started at Yonker Rehab back in 1982. Thought I was only going to be there a couple years, and now 35 years forward, I'm still there. If any of you in programs know, sometimes you kind of get pushed into a area, maybe not so much what you thought you were going to do, but there was somebody who was doing the driver's eval who left, and I kind of got chosen to go into that, and I've been doing driving since probably about 1985. And believe me, things have changed a bit. What we used to see a lot more were physical disabilities returning to driving. Now, probably the last 2 years, the biggest majority of our drivers have been older drivers with various diagnoses and that. So I'm an occupational therapist, and I'm also a certified driver rehabilitation specialist. I belong to an association, used to be ADED, Association for Driver Educators of the Disabled. Now it's Rehab Specialist. And I sat and did my certification in 1997. So most of my job is driving. I also do wheelchairs, which kind of complements that, and then some other general clinic patients. My outline, let me get my thing here. My outline, I'm going to talk about dementia and Alzheimer's, the aging process and how it affects driving, warning signs, behavioral signs to kind of look for, DOT rules, and then kind of what I do in a driver's eval, and then I've got a lot of resources. And I may have too much stuff to go over in 50 minutes because I think they want me to talk for 50 minutes and then open it up to questions. And then also, if I get time, Deb Carney is my contact at the DOT. And about 3 weeks ago, I had asked her if she had anything she wanted me to share, and she did, but then she went on vacation for 2 weeks and just sent me this stuff on Monday after I had sent my presentation. But Tim, the lovely gentleman up there, has put it on, so if I get time, I will go through it. You also will be able to have access to that at the end of the session. Let's see. So driving and dementia, I may kind of just go through some of these statistics fast because I think I'd rather get to some of the more meaty things. But an estimated 5.5 million Americans of all ages have Alzheimer's disease. By 2050, the number could rise to as high as 16 million. Deciding when to stop driving or to limit driving can be a confusing issue for both the individual and for the caregivers. And that's probably a lot of the calls I take are from family members, adult children saying, I'm kind of concerned about my mom. I don't know what to do. And my supervisor kind of yells at me for answering all these questions and answering my phone, but I feel like that's my resource, and that if I can help someone figure out what they need to do, that's what I need to do. People with dementia are especially likely to minimize the complexity of driving and overestimate their abilities. I often hear people say, well, I've never had an accident. I've driven for 80 years. It's not going to happen to me. Well, I can attest to that it does happen to people. My brother was unfortunately killed in a car accident last year. He was a mile from home on a gravel road, area he knew, forever, and crossed over a paved road. And I don't know if he had something with his heart or if he just didn't see it, got hit. and was killed. So I do know for a fact that things can happen much quicker than you expect. People can lack insight. Drivers may continue to drive after becoming lost. I've had numerous people come to me for an evaluation that intended on going one place and one person ended up in northern Minnesota. They were supposed to be, I think, going to Mason City and ended up a little too far. Some drivers with dementia rely on co-pilots. And my take on that is navigation is okay. Like when my husband and I go on a trip, if whoever's driving, they're going to, like we say, okay, at the next light, that's where you got to go. That's the turn. Or my little Garmin will tell me that. But what's not okay is when, someone is telling you, okay, at the next light, you have to step on the brake and turn your signal on and telling them every step of the way. And I know there are probably drivers that are out there that come in like that. Caregivers and family members must step in and assume the responsibility for monitoring and regulating the driving. There's the whole question of liability. If a family member knows someone should not be driving and is still letting them drive, that's kind of a very gray area. Could you get sued? I don't know. I went to a session probably 4 or 5 years ago put on by the DOT and multiple different groups, and there was a lawyer that talked, and they kind of talked about that if a family member knows they should not be driving, they could be held liable. And my other take is, when I tell patients that you really shouldn't be driving, if you got in an accident and got sued, there's potential. You could lose a lot of your fund, your things your money that you worked hard to, obtain. So sometimes that makes a difference, sometimes it doesn't. Stats from the National Highway Traffic Safety Administration, 4.7 million drivers 65 and older by 2015, and 29% increase in people 65 and older from 2006 to 2015. 6,165 numbers of people 65 and older killed in car crashes. Rate of driver death in automobile crashes rises after age 60. Although seniors have fewer crashes, they are more likely to be seriously injured, partly because of debility, arthritis, those kind of things. The most likely to be involved in an intersection accident because, as you know, that's where you have to make a lot of complexity. Decisions, is there a big enough gap? Can I make that left-hand turn? Those kind of things. Because older drivers may be more fragile, their fatality rate are 17 times higher than those of 25 to 64. Driving involves, judgment, multitasking, cognitive skills. They may decline with both age and may be affected by dementia. And Alzheimer's may increase the risk of driving. Every 66, this is all from, some of the statistics is from the Alzheimer's Association, which I'll put a plug into them. They have a great website as far as just basic information, caregiver resources. If you ever get a chance to go to the Alzheimer's Association, they have a conference every, I think it's usually in April in Des Moines, and they have different speakers. That's a really good resource for presentations on different topics and resources. By 2050, estimates for persons age 65 and plus range from 5 million to 16 million with Alzheimer's disease. And that's just a varied rate of, the level. That there's some people with Alzheimer's that really function very, very high. There's ones that do not function well. I was kind of surprised it says it's the top 10 cause of death that can't be prevented, cured, or even slowed. I don't know if there's ever going to be a time frame when there'll be, research done that they can prevent it in our lifetime. I don't know. I wish. Okay, normal changes with aging, decreased pupil size, your ability to adjust the low levels of illumination. And I hear that from a lot of people as they stop driving at night because nighttime driving just is really a big thing that's a little bit more difficult. Difficulty focusing, inability to change focus points to see objects clearly at all distances. Like, when you're driving, you're looking at your speed, you're looking ahead at the light, you're looking at the traffic on both lanes. That difficulty in coordinating back and forth. Decreased glare, threshold recovery, again, that nighttime driving. Peripheral vision may decrease. I have had a few people tell me when they've had their cataracts removed, and I don't know if there's an ophthalmologist in the crowd, but it seems like when someone has had a cataract, sometimes that peripheral vision is just not as sharp as it used to be. And that's where side mirrors and doing that head check back and forth is what's really going to be necessary for them. Decreased color perception, yellowing of the lens. Arthritis can cause decreased range of motion in about any joint. Neck is probably one of the big ones. People can't do that check to check for the lane change. Pain, weakness, osteoporosis puts them at a higher risk if they are in an accident for bone fractures. And then other medical conditions, peripheral neuropathy, stroke, debility. So you can see combining the medical things and dementia can really have a negative effect on safe driving. Aging process, again, just some statistics. Population is aging at a faster rate than it is growing. Older drivers, 65 and older, represent a significant portion of the proportion of the population. By 2020, it's estimated there will be more than 40 million licensed drivers 65 and older. Alzheimer's, and this is the definition that's on the Alzheimer's Association. It's the most common form of dementia, accounting for 50 to 80% of dementia cases. Causes problems with memory, thinking, and behavior. Symptoms usually develop slowly over time and get worse over time, becoming severe enough to interfere with daily tasks. On their website, they say Alzheimer's is not a normal aging process. Again, the Alzheimer's Association is a good resource to look at. 10 warning signs of dementia: memory loss that disrupts daily life, challenges in planning and solving problems, difficulty completing familiar tasks, confusion with time and place, trouble understanding visual images and spatial relationships. That I see a lot with the driving task. Lane position, coming up to an intersection, can they judge, where they need to stop? New problems with words in speaking or in writing. Misplacing things and losing the ability to retrace steps. Decreased or poor judgment, withdrawal from work or social activities, and changes in mood and personality. This one I thought was just kind of interesting. I threw this in. This is, again, from the Alzheimer's Association. So on the left side, signs of Alzheimer's, and then on the right side, typical age-related changes. So poor judgment, decision-making, and then maybe some things that we all maybe have done in the past, making a bad decision once in a while. Alzheimer's sign would be inability to manage a budget. Missing a monthly payment would be some age-related. Losing track of the date or season. That's probably the biggest thing I see when people come in. They'll say, I'm retired. I don't need to know the date or the day of the week. But typically at least the month, the year. Oftentimes you'll know the day of the week. Sometimes not that date number. Typical age-related, forgetting which day it is. I just went on a cruise, and it was sort of funny. In the elevator every day, they had a rug that stated the date of the week, like Sunday through Saturday. So that was kind of nice because, when you're on vacation, and I guess maybe when you're retired, that might happen, that you kind of sort of forget. But I thought that was kind of cool. So every day I had to take a picture of the day of the week. So difficulty in having a conversation. Sometimes forgetting a word you want to use. I notice as I've gotten a little older, every once in a while I'm like, oh, gal, or like patience. I used to be known as the therapist that knew everybody, remembered everybody's name. I've kind of lost that skill a little bit. I don't think I have Alzheimer's, but I think it's probably just a little bit more age-related memory things. Misplacing things and being unable to retrace steps to find them. We all lose things every once in a while. Okay, potential impact. I went to a conference. I go to the ADID conference about every 2 years in order to get my CEUs, and then also just to kind of, with funding, you don't always get to go to all the workshops you want to go to. And some of this came from that workshop, which I thought was really good. It kind of talked about the impact and then how it kind of relates with driving specific, like memory loss that disrupts daily life, difficulty making and keeping appointments, evidence of memory loss during the interview. What I see on this is patients will make their appointment and have to call me or call our secretary 3-4 times before they remember what day they're supposed to come, or they show up on the wrong day, which happens. And I'm sure some of you may see that same thing with some of your clients coming. Forget destination, purpose of trip, sees but quickly forgets posted speed limits. That's one of the things on our route. Like I see someone for the in-clinic, and then my coworker, Lance, who's a COTA, he takes him out on the road. And so he'll give maybe a specific direction, like at the next light, which is at, Walnut Street. You're going to take a left. That they've forgotten in that short period of time what that destination, what that target they're supposed to be going to. Confusion regarding rules of the road, tries to make a left turn on a right or make a left turn from the right lane or vice versa. Challenges in planning or problem solving, impaired trails test, maze test, traffic signs. On my test, and I'll show a little bit later, I use the trails A and B. A is 1 to 25, B is alternating 1A, 2B, 3C all the way through, and oftentimes I see they're having trouble with that. They may have trouble out on the road. Difficulty planning a route to familiar destinations. That's where I sometimes find family members saying, they used to be able to get to my house. Now they're often calling me partway, forgetting what turn to go on, or maybe going to the beauty shop. They forget they forget how to get there. That can kind of be an issue. Making wrong turns, unable to return to their original route. Drive in unfamiliar areas, does not stop to ask for assistance. I just had a little lady the other day who we were seeing quite a bit of issues with her. And she had a stroke. She lived in Altoona, which is on the east side over by Adventureland, and then liked to go to Jordan Creek, which is about as far opposite to shop. And I said, how do you get there? And she said, Siri, take me to Jordan Creek. I'm like, number one, I was kind of shocked because she was 85 and she had a smartphone, which that'll be us in about 30 years. But then when she got to Jordan Creek, and she couldn't even tell me if she took Highway 5 bypass. I mean, that was concerning to me that she didn't have a clue how she even got there. And then when she would get ready to come home, I said, how do you get home? Siri, take me back home. And that's, I guess, kind of good that she knew to do that, but I guess my worry would be, what if her phone is dead? What if Siri takes her to Timbuktu? Because I know Siri's not always 100% right. Or your Garmin, so that's a little bit concerning. Difficulty completing familiar tasks, finding their license, like when they come in to get checked in. Oftentimes our secretary will flag me down. That's what I say that fails the secretary test. She'll say, Sue, this person, I don't know about them. I think they're not going to do well. And I'm like, and she is pretty much spot on, because if they try to give her their license, or she'll say, I need a copy of your license, she has gotten, their car insurance card. She has been given a credit card before. They're just confused on that. Or oftentimes they will have someone else do it for them, like the wife will be helping the husband. She has the wallet, she's digging everything out, or vice versa. So yeah, quite often our people lately have been failing that secretary test. Out on the road, we see them putting the key, difficulty putting the key in the ignition, starting the vehicle, using the gear selector for a turn signal, those kind of things. Confusing accelerator and brake pedal, confusion or forget the gear selector. Confusion on time and place, arrive at appointment or wrong day, difficulty finding appointment location. And granted, to find, kind of with you guys, I'm sure sometimes, you're a large complex, having people find your location for the first time can be a little bit confusing for them. But I get pretty good directions and pretty specific directions, and sometimes it just doesn't seem to work. They either forget the directions or have followed the wrong thing. But concerning to family members is, again, becoming lost in familiar surroundings. Again, like going to the beauty shop or the church or family members' homes. Trouble understanding visual images and spatial relationships. Low score on the MVPT is a motor-free visual perceptual test that I use. Sometimes the draw clock. Low scores on that. I've seen usually preempt that they may not do very well out on the road. They drive wrong way down a one-way street, makes turns on the lane of opposing traffic. Difficulty with lane control or parking. You have all seen in the parking lot where somebody's parked real cockeyed. They pull in, a big swing and pull in. Stops at green lights or along the roadway. This has been happening quite a bit for Lance. That he's noticed is that people will, they'll just stop in the middle of the street. And he's like, what are you doing here? You gotta keep on going here. And they just stopped for some reason. They couldn't even answer why they had done that stop. So that's a little bit concerning. Just the other day, when I was coming to work, it was one day last week when it was actually raining. And I don't know if you know very well, but ML King is a big street going southbound, like towards the airport. And I cut across on Cottage, and I'm sitting about four cars back from the light, and I saw this car that was going southbound, and they stopped just past the turn to make a left-hand turn and just stopped in that intersection, or stopped on the street. Light turned, red for them, green for us. Nobody went because that little car he sort of turned their car around, and traffic just kind of let them go on there. And I kind of got up 2 cars behind them, and they were doing like 18 miles an hour, and they had a hanging tag sticking from their windshield. And I know they probably didn't know where the heck they were going. And, bad thing, rain and rush hour. Again, those 3 combinations were not good. And that could have potentially had a bad situation. Everybody kind of, I think, just stopped because they knew the person didn't know what the heck they were doing. So that's when we see issues like that. I kind of thought, oh my gosh, that guy probably needs, or woman, whoever it was, needs to come and see us for a driver's eval. But those are the kind of situations, and I'm sure you all have seen things like that. Let's see, new problems with words and speaking, difficulty answering interview questions, difficulty filling out forms, unable to ask or make verbal directions. And this is where sometimes I see when someone has come to us because they've had an issue with the DOT, they might have had a fender bender, and they are stopped by the police, and they just can't pull it through. They just can't answer the questions right, and that's kind of where that whole issue when they start coming for a driver's eval, that may have been because they can't think of the words they want to say, or just can't answer simple questions. Difficulty understanding written road signs. I think the sign that is the one that people just don't know is lane ends, merge left. And I know there's lots of those signs out on the road, but that's probably my number one that people just don't understand. They have, oh, you gotta go around it, or you have to stop. Those are some concerns to us. Misplacing things and losing the ability to retrace steps. Unable to find license, although license is in the wallet. Can't locate car insurance. Loses license or car keys. Frequently unable to locate personal vehicle in a parking lot. I'm sure you've all heard that. One of the things that I've been seeing more of is, like I'll ask them, what kind of vehicle do you drive? And they'll say, well, it's, the other day I had somebody tell me it was a Taurus Camry. Like, okay, a Taurus is a Ford and a Camry is a Toyota. So what kind of car do you drive? And I guess, and maybe I'm being very prejudiced, but sometimes I understand why maybe a little lady may not remember what they know that they drive a brown car. They may not remember the model, but sometimes I would think a male probably, and I'm being very sexist, would probably remember that. And sometimes they don't. They can't remember the model. They start digging out their wallet to find their insurance card, which I think is kind of savvy on their part, but doesn't quite help me with to figure out what they have. Decreased or poor judgment, purchasing a new car despite recent at-fault crash or license suspension. And I have had family members tell me that they have somehow got to the bank and got some money to buy a new car when they don't even have a driver's license. Seeking multiple driver's evaluations despite repeated failures. I have had several in the past clients come back like every year they want to come and have a retest and drive, and it's just hard for them to get it that they just really should not be driving anymore. No longer using turn signals because they're avoiding wearing out the bulb. I've heard that before. Unable to judge the safe gap in traffic for turns, lane changes. Withdraw from work or social activities. Family reports decreased social participation, becoming lost in familiar areas. And sometimes I have had patients be very blunt and very honest with me. I'll say, are you scared to drive? And they're like, yes. Then I want to say, well, why are you here and why are you driving? Sometimes it's just that they want that driver's license, just something in their hand. It's kind of sad sometimes. Changes in mood and personality, easily frustrated, agitated in response to the clinic tests. Just the other day, I had somebody who kept saying, what does this have to do with driving? I was doing some visual perceptual stuff, and as we all know, visual perceptual is pretty important for driving. Lane position, turning, space, depth perception, and she was very not happy with me. And I've probably been called about every name in the book when I've suggested people that they really should not be driving. Ultimately, it's the referring physician's position to say yay or nay, but I'll just say, our recommendation to the physician is that you really need to stop driving. We find and we try to show them what we're seeing as issues, and still just does not come out there. Behavioral signs to observe on a day-to-day basis. This is some things I tell family members to keep a look at. has become less coordinated, or even you might see this in your clinics, has difficulty judging distance and space, gets lost or feels disoriented in familiar places, has difficulty engaging in multiple tasks, has increased memory loss, especially for recent events, is less alert to things happening around them, has mood swings, confusion, irritability, needs prompting for personal care. I kind of see that, even though they're coming in to see me for a driver's eval, I sometimes see that they're kind of disheveled, they're just not quite put together, and maybe it's somebody that I worked with a long time ago. Sometimes I have concerns that, are they okay to be living by themselves? And again, they're not here for the driver's eval, but I guess that OT in me is like, I'm kind of concerned about some of the things they might be doing. Needs prompting for personal care, has difficulty processing information, has difficulty with decision making and problem solving. Things to continue while they are still driving, if they're driving too slowly. One thing I often will suggest to family members is if they, I'll ask them, have you driven with your mom and dad lately? And I have had, which is, I'm happy to say, some family members say that they take their parent out every 2 months and drives with them. I mean, that would be wonderful if everybody could do that. Not everybody has family to take them out, but, just that observation kind of thing really does. Things to look for, are they driving too slowly? Are they stopping in traffic for no reason? Becoming lost? Lacking good judgment? Lane changes, drifting into the lane. We see a lot of that, drifting over, back and forth. And I know some people, my husband tends to drive way over here. It drives me crazy. I like to drive in the middle. And that's how some people do. But when they're over the line a lot and we're having to grab that wheel to pull them back in, not a good thing. Signals incorrectly or does not signal. Difficulty seeing pedestrians, objects, or other vehicles. Falls asleep while driving or gets drowsy. Parks inappropriately. Gets ticketed for traffic violations, frequently being honked at. I'll often ask patients, have you been honked at recently? Yeah, I don't know why. I don't know. I've just been honked at lately, and it's probably because you're doing something a little bit not so good. Increasingly nervous or irritated when driving, has accidents or near misses, fender benders. The little fender bender thing, I'll tell you, my mother-in-law, and she probably would be mad if I was telling the story, but she is just turned 90, lives in a small town, and I wish she would just drive in that small town and around that small town. And there is a thing I see, if somebody's from a small town and maybe is a little marginal, they probably still can maybe continue to drive if they're just sticking around there. But if she wants to drive to Des Moines, I'm encouraging, again, I'm the in-law, so I'm telling my husband and his brother that they need to be the bad guys and say, Mom, you really shouldn't drive to Des Moines anymore, because it makes me really nervous. It's a lot of complexity compared to a little town driving. But she was in Carroll and missed where she wanted to turn. This is her story. And she came back around, and that other car was going just way too fast and hit her. And I'm thinking probably at the scene of the accident, she tends to talk a lot, and she probably may not have answered things, plus she doesn't hear well. So she probably maybe didn't answer because she didn't hear the question, and she got a lovely little letter, which I'll show you shortly, inviting her to the DOT. And that's kind of how oftentimes we get people referred to us, because they've had a fender bender, and that's where everything starts. Let's see here. Difficult driving situations for older drivers. Left turns, because you're having to cross over, just that whole complexity. And I don't know if anybody is familiar, but in Des Moines on Douglas Avenue, there is a Beaverdale Estates, which is a retirement community. And I had a little lady who, she liked to go to Merle Hay Mall. Everybody likes to shop, seems like. And I said, how do you get there? And so the shortest way would be to make a left-hand turn onto Douglas, crossing over 4 lanes, and go to the mall. She said, no, you're probably going to laugh, but I do this. I turn right out of the driveway, and I go to Beaver. And then I go down to Urbandale, and I take a right. And then I go to Merle Hay, and I take a right. And then I get to Merle Hay and Douglas, and I take a left because there's a left turn signal. 3 rights make a left. So that's a good skill to have people do. Changing lanes is a hard one. Again, they can't turn that head to do the lane change, or they just kind of whip it over there. My coworker has had to step on the brake several times because people have just kind of whipped it over there, not looking. And, by luck, we have, been able to miss an accident. Parking lots or driving can be driving nightmares. I used to have, when my dad he drove till he was probably 89 or 90. And he and I would go round and round. Like I'd go into a parking lot, you pull, if it's a pull through, you pull to the farthest one, then you can drive out. You don't have to back around. He always told me that was illegal. I'm like, no, it's not illegal. It's safer because you can always, if you drive out, you can see better than when you're backing. There's always that kind of blind spot on both sides of your car. Cell phones and other electronic devices. The use of GPS, I guess that would be a question I would like to know if you all think are good or bad, because, if Siri is telling you, or not Siri, but if your GPS is telling you to take a right-hand turn and it's a one-way street, that's not a good thing. Older drivers, I think sometimes if they're just learning how to use a GPS, that might be even worse because they don't remember how to set it up. Somebody who's been used to it, probably not a bad idea. The other thing that I'm kind of scared about is, and maybe I'll retire before this happens, but the driverless cars. If someone's got dementia and they're in a car that, that's the way they think they're going to be able to drive, I don't know. I haven't gone to a conference. Probably the next conference I go to for our driving association, I would think that might be one of the topics, is how are we going to deal with people that have dementia and are using a driverless car. Another issue, dark, rainy nights. By the time we reach our 40s and 50s, we have already noticed that our vision is less sharp on dark, rainy nights. Strategies for safe driving. These are things I sometimes give to my patients. Sometimes they listen, sometimes they don't. Avoid distractions such as eating, listening to the radio, having a conversation. My good friend, she used to do drivers evals, and her dad has a starting of Alzheimer's, and he has a GPS, and his wife likes to talk a lot. And so when he used to drive, she'd be giving him directions, and the GPS would be giving him directions, and he just said, one of you have got to shut up. I can't take directions from both of you. So the fewer directions and the more simple directions probably works better. Driving the vehicle you're most familiar with. My mom and dad, when they lived on the farm, my dad always drove the truck, and my mom drove the car. And driving the vehicle that you're most familiar with is great. I think it's the best thing if you can do. Example of my mother-in-law again, she had when my father-in-law was alive, he liked to trade cars every 3 years. They would get a new Buick. And after he died, she went 5 years and she wanted to get a new car. So she got a new Buick that has a push-button start. And it has kind of been a nightmare. She'd call my husband and say, I can't find where's the turns, or where's the windshield washer? It's like, oh my gosh, that's not a good thing. So driving cars, keeping them up, I guess when they're older drivers, keeping that older car that you're familiar with, where everything is probably a big advantage. Planning and using familiar routes. Using traffic lights to make a left-hand turn. Choose times of the day when traffic is less busy. Like I often tell people 9 to 11:30, because that way people have gone to work. And then before lunch hour starts, because sometimes people run errands and they don't pay attention. 1 to 3:30, a good time because people are back to work and a little less traffic. And then like after 6:30, at least those are kind of times in Des Moines. And avoiding the freeway is a thing I tell everybody, however old you are, because I think the freeway is kind of crazy sometimes. Nighttime driving is more difficult because you don't see your landmarks, like maybe you always turned at that, that one sign. Well, if the sign's off at night, then you're not going to see that sign. The left-hand turns, keeping your car in good working order. Cell phones are great, but, don't talk and drive or text. Be aware how you feel, if you're stressed. And I've seen a few people come in for the driver's evals that they're just frazzled, and it's like, oh my gosh, I almost want to send them home and tell them to come back another day, but then I also think, is this the way they are when they're out driving because they're so nervous? Utilize good driving techniques, checking your blind spot, using your turn signals, following the proper speed, always wear your seatbelt, don't drive with your parking permit hanging them from your window, and we all know everybody does that, but when that's hanging there, if you're at a stoplight, somebody could be walking across the crosswalk, and that thing could potentially block them from seeing something over there. They don't agree with me when I tell them that, but if in doubt, don't go out. Bad weather, rain, snow, busy times of the day. Look for a different route that can help avoid places. And I find a lot of people coming in and telling me that. I used to use this, now I go this back way. Deerfield is a senior community out on Hickman Road. Hickman Road has become crazy traffic. And a lot of people now, instead of making that left-hand turn, they'll go to the next light, they take every route that they can to make to bypass the busy roads. Making sure there's enough space behind you and the car in front of you or behind you. What is safe is not always legal, and what is legal is not always safe. What I mean by that is if you are, your posted speed limit is 65 or 70, and it is snowing, you're not going to do the legal limit. You better probably slow it down. Or I have found that on 235 going westbound at 5:30, sometimes you have to go above the speed limit because everybody else is going fast. And sometimes if you're going so slow and everybody's behind you, they can't judge how slow you're going. So don't let anybody force you to do something you don't feel unsafe with. One thing when I was doing this presentation, I was telling, I think it's Sally, that I used to think that at 70 was when you could get your license for only 2 years. Now, I found out when I went on the DOT website that they're transitioning their renewal process. They started in 2014, and they're going to go through 2018 for a 5 to 8 year renewal. So what used to be 70 was 2 years. Now, 17 and 11 months to 66, you're going to renew for 5 to 8 years. Randomly selected, age 67, 5 to 7, 68, 5 to 6, 69, 5-year renewal. 70 year is a 4-year renewal, 71, 3, and then 72 and above are 2-year renewal. So I don't know how that's going to impact some. And then they also reinstated the renewal online, which I think can have some effect on people because, they may not think that they have any physical disability or any cognitive disability, and they're just going to renew online. The DOT can request a drive test at their discretion. It's called a line re-exam. Sometimes the red flags that they'll see is if, again, husband and wife go up to the desk, they're asked to get their license out, the wife is doing everything or the husband's doing everything. They can't answer questions. A request for re-exam can come from a police, doctor, family member, and at the end of this I'll show you there's a form that Deb sent me that anybody can fill out. The only thing is, if, say, a family member wants to report someone, then that person has every right to ask, who was it that said I shouldn't drive? So as long as the family member is okay with them knowing that it was them that ratted on them, that's okay. But that's public law. They have to be able to ask that. Fender bender often will kind of instigate the process. There's also certain diagnoses that will only allow, and medications. Some people may only be able to renew for a year or two. Here's a letter, example letter. It's not my mother-in-law's, but it's some another patient. But that kind of shows what happened, subject notice for department re-exam, gives them a date when they're supposed to show, and then they will make exceptions. Like my mother-in-law example, her car got damaged enough that she was on a rental car. And when she told me she was going to have to go, I contacted my contact and say, is there any way she can extend that? I don't want her driving a rental car because, she doesn't know where everything is. And that was extended out. So the DOT is very willing to work with people. So the DOT little mental fitness test, and the form that I'll go over if I've got time, this kind of goes through it again. What is their date? I don't know if the Des Moines Register I think it was last week, there was a big article that Deb was quoted at. Someone had gone into the DOT and sounds like they may not have had any cognitive issues. It was more physical issues, and they were given this mental test, and the person was not very happy with it. And I think it's just kind of a random thing, but they basically asked their date of birth, month, date, address, state you're in, city, kind of like a lot of the ones that, like the mini mental status exam, which I just learned. I went to a little conference the other day that the mini mental status exam now has a version 2. And I didn't know if everybody knows that, but there's a version 2 on it. Then scoring. Okay, they'll be sent a letter like I showed you for re-exam, vision test, knowledge test, behind the wheel, may need a medical report by the physician. They have 3 attempts. Like my mother-in-law did not pass the knowledge test last week because she was given it by computer. And computer in older people that have never used a computer can be very intimidating. And plus she read a couple questions wrong. So that's one thing. They must pass the knowledge test before taking prior to taking the drive test. They can ask for it to be that knowledge test to be given orally or a written form. They can also, I've had people come through that are in the appeal process, and they just don't understand why they shouldn't be driving, and they can go before the appeal process. It's not an easy task to do, and typically with the DOT appeal process, they'll go through their medical review board, and oftentimes it's found that they should not be driving. I also have been seeing a lot of people that are going through getting several doctors, like their primary doctor says they shouldn't drive. Then they're going to doctor hop to another doctor and try to get that process through. The DOT is pretty much set on if whoever started the process needs to be the one that finishes the process. Like if they need a medical report filled out, that physician has to be the one to fill it out. This is a little sample of a person I just recently saw. They get this form. This was the little cognitive screen. They didn't do very well, and then they went back to their doctor, and then they got sent to us for the driver or for a full driver's evaluation. This is a practice test, the DOT, and this is just another resource I thought I'd share with you. The DOT has their practice test, which I actually did this for my mother-in-law. I took the test, and I'm not proud to say I missed 2 questions on it. One was a sign, and one I actually read the question wrong. It was left, and I misinterpreted it. But this is something that they can go online and practice. I give that to a lot of patients if they want to really kind of bone up on what the questions might be. Here is a vision form I thought I'd share. If I have had someone who, particularly somebody who's had a stroke that maybe is aphasic, that has difficulty answering questions, may not be able to tell, when they're doing the vision test at the DOT, they can take this form to their eye doctor, and the physician can fill it out, and they will take this to the DOT, and they will not have to take the vision test at the DOT, which I think can kind of decrease some of the frustration on the patient's part. It needs to be done within 30 days, though. Possible restrictions on license: no driving when headlights are needed, no freeway or interstate driving, a certain mile radius. Miles per hour, I've seen it as limited as like 30 miles per hour. Or 45 miles per hour. Just the other day, I saw one that was the craziest I've ever seen. The guy was limited to 30 miles from Des Moines and 30 miles from Cedar Falls, but couldn't drive to Cedar Falls. He has 2 homes, and so his doctor did not want him on the freeway. So the DOT, that's what, and you can write in anything, any physician can write, a physician, nurse practitioner, and a PA, I think, are ones that can do it. Like there's some physicians, like a rheumatologist, for some reason, is not allowed to do a medical report. I think it's kind of dumb. But anyway, you can write in there if you don't want them on the freeway. The physician, the DOT will kind of abide by what because you know that person better than they. 6 months seizure free. At one time, they were going to try to drop that down to 3 months, but I think that never got passed. So it's 6 months seizure free. And there's also that gray area. Technically, they're supposed to surrender their license in between times. I know a lot of physicians, if they know the client is not going to drive, then they don't do anything with the DOT, which kind of makes life probably a little bit easier for them. Parking permits are no longer required to have an application. You just need a letter from your physician stating, or from the physician stating that they need the handicap tag. Again, I don't recommend people driving with their tags, and then they can also buy a license, the little sticker that allows them, they don't have to have the tag in the window. The tags are more portable. Like when my mom and dad needed them, I would take my mom somewhere. I had the tag. My brother would use it. He would, have her tag with her. So the tags do make a little bit more portability. This is a guide. I still have the old version, but this was kind of a collaboration with National Highway Traffic Safety and a couple other organizations. But there is now the 3rd edition of it. Kind of goes through all the different diagnosis and how you can kind of weed out should someone be driving. There's the resource for it. DOT medical report completed, maybe asked to complete the DOT. Every item needs to be addressed. I have seen people come back because the doctor didn't check a box, and the DOT is very picky. If something's not checked, it wasn't done. So make sure everything is on that. They can request the person must drive with an examiner. Like you may not recommend them for a full evaluation, like with us or with somewhere else, but want them to be tested with the DOT. Again, you can write whatever you want on that form. They may refer them to us for a driver's evaluation. In order for us to see, I do need a physician's referral and any kind of visit notes, because sometimes people will come and I'll say, so what's going on? I don't know. I don't know why I'm even here. And that doesn't help me. Any kind of notes really kind of helps me. Yes, they have pre-Alzheimer's, or they have dementia, or they have Lewy body dementia, whatever the case may be. It's a 2-hour evaluation. I try to get a basic history, kind of where they drive, what type of driving they're needing to do, if they've had any accidents, if they've gotten lost. I had a couple people, like again, picking on Deerfield, out in Waukee. I had a gentleman who had moved from the south side of Des Moines, very Italian. He was going back to the Italian Center for a little get-together on a Thursday night, and he got lost. Ended up in Leon, Iowa, which is down almost to the Missouri border. So, and I'm finding that when people are moving from one area to another, that's a big area, that's a concern for me because they know where they used to go. Like a lady was moving from West Des Moines to Johnston on Merle Hay Road by, I can't remember what facility she was moving to. And again, she's not familiar with the traffic, she's not, and she did not do well, so our recommendation was to stop. But those are kind of some areas of concern. Look at visual perception, strength, coordination, reaction time. Have the behind the wheel eval. I used to do those for a while, and I'm not cut out for that. And Lance loves it, and so I'm happy. We used to have a driver instructor. The driving program started back in 59. Dr. William DeGravels was the medical director, and he had polio in med school, and he drove with hand controls. So the story goes, they would use his car to do training, and then one time they almost hit a brick wall. So then they collaborated with the Des Moines school system and started the driving program. And then when Leroy Roshafer, who was my driver instructor and mentor, retired, they cut that tie. And so then we had a driver instructor, but there was a little time period when budgets was cut, and I was made to do the behind the wheel, and not for me. Now Lance loves it, so I'm glad. They drive our vehicle, which does not make them happy. We give them time out at Waterworks Park to get used to the feel of the car. We have a Buick Lucerne. But our reason for that is he's got a brake on his side, so if he needs to intervene, he can get the car stopped. This is an example of the Trail A, 1 to 25, time them, and there's specific age ranges. I look at that. This is Trails B, more complex, alternating between number and letter, and this is where people often will bomb. They may start out 1A, 2B, 3C, and they get a sample before this. They'll start out 1A, 2B, 3C, D, E, F, G. They forget they're supposed to be dividing their attention. This is my driving simulator. And we used to have a very, very ancient one. This one we got about 2 years ago. And the big things that I use on this is like reaction time for gas and brake, reaction time for steering, like they see a target. Now this program is a little bit more complex, and I don't always use it with my older drivers because simulators and older drivers, sometimes they don't quite like it. And this one, they have to stay in their lane, they have to hit the brake light, and then they have to look for targets. So it doesn't always do well with that. Let's see. We often can get a special permit if someone does not have a driver's license, and I see them for an in-clinic eval, and I think maybe they do have potential. We can get a special permit from the DOT. I've been doing more in-clinic evals than probably the last 2 years, and I often will find them not appropriate to proceed and need to recommend that they stop driving. Possible suggestions, limiting time. I'm going to jump through here. Driving is a very touchy subject. Liability issues we need to talk about, with families. Oftentimes, if someone is going to stop driving, we recommend that they surrender their license. Go in and get an ID only. And I will tell you that at the DOT, they still had, because this happened to my brother and my dad. My dad went in to get his ID because his license had expired. They said, well, why aren't you getting your license? And as loud as he could in the Buchanan County courthouse, he said, well, my kids sold my car and told me I can't drive. And I one time met with the director of driver services, and I said, you guys, you got to help the families here. And she said they have to legally ask that because some families will tell people they shouldn't be driving when they maybe should be driving and they want to sell a car. So, touchy. Driving is a privilege and not a right. This I just found the difference between a safe driver and one who should no longer be driving. One who recognizes age-related changes and takes steps to compensate. The other one simply ignores or denies diminished abilities and changes over decades. Let's see, let me buzz through. I'm just going to kind of go through here. This is a left foot pedal. A lot of my older drivers I don't see much with adaptive equipment because if they're already having cognitive issues, learning a new thing is not going to be easy. Left foot pedal sets to the left of the brake here. Let's see. Right there's the brake. Is that working? There's the brake. So if you've driven for 40 years, you've always gone right to gas, left to brake. A left foot pedal, you're going left to gas, right to brake. And that can really mix people up. Right hand controls are the same way. Now I can make exception. We had one little 84-year-old lady who had peripheral neuropathy, sharp as a tack. She learned to drive with hand controls and is probably still driving. Very few between. Spinner knobs sometimes if somebody's had a stroke. Programs, we're in Des Moines. St. Luke's and Cedar Rapids and Mercy has a program. Our goal is to make sure it's safe for everyone to be on the road. I had to fill out a little thing, take home point for you all. I guess one thing I would say, would you want to meet your client on the road? kind of think about that, because I've had a few people in my neighborhood, I'm like, I really care not to have them maybe in my neighborhood driving, because I know, things. I'm not going to go through this, but alternate transportation, family and friends, public transportation, taxis. Now, taxis and Uber and Lyft, they're kind of the new thing. You actually can, I found this out, I had a patient tell me this. They worked with Uber, a local Uber driver, and they pay ahead and say, I want you to take my mom to the hairdresser every Thursday at 2 o'clock, and she doesn't have to worry about paying. So, I mean, there's services out there that can be helpful. Elder care, there's some resources. I wanted to show just a couple things here. The Hartford is a great resource. They have lots of things. And this is one of the books, and I've got a box down here if anybody wants to pick some up. I ordered them. One is called We Need to Talk, Safe Driving for a Lifetime. And the other one is At the Crossroads, Conversations about Alzheimer's disease. I went online and got the box, and I was kind of excited because they asked, it dropped down, and there was an OT there. It said for occupational therapists. So anyway, okay, let me quick go through. Oops, maybe I'm not going to. This is the PowerPoint. Nope. Not sure. Oh, there we go. This is Deb's PowerPoint that she sent, and you all will have access to it. It talks about the screening, where they got it, the testing, all their process on this. So that one, and then I want to show you, oops, maybe I can't stop that. Yeah, I'm not very savvy, but there's a form that, oh, here we go. Oh, thank you. Thank you, Tim. This is a form that anybody can fill out that, like, say, if you have a client that you feel should be tested, that's the form that you can access. Deb Carney, her information is on the other thing, and she said, if anybody wants to contact her, she is more than happy. She's the director of the Older Driver Services, and she's a wealth of knowledge. She can very, very helpful. So I know I've kind of ran long. Any questions I can answer for people? Yes.
Yeah, this is a little different topic, but for physicians that prescribe narcotics, for patients that continue to drive and they're taking large doses of narcotics, do you have any information, or maybe anybody else here has information about what is the legal liability for the physician if that patient who, for instance, is on a Duragesic patch or fentanyl patch or something like that is involved in a car accident?
You know what? That would be a question that Deb Carney, I think, could answer for you. And her information will be on the other, that one that's going to be attached onto here. I do not know the answer on that one.
Okay. And then if you take somebody's driver's license away, how do they get a photo ID?
They go into the DOT and they say, I want to surrender my driver's license. And then they will be asked, well, why? But, they'll say, yes, I'm stopping. And then it used to be free forever. Now I think it's 8 years, and then you have to go in and get another one.
Okay.
But
so
yeah, it's just an ID. Yeah.
Okay.
That way they can travel.
Right. I was
my dad, that was why he went in and said that in front of the DOT.
Okay.
So.
And then it was my understanding, because I had a patient a couple of years ago that just clearly should not be driving, and I talked to her. She said she was going to continue to drive, and so I called the DOT, and they said, well, you just write a letter, send it out to us, saying
and this form right here would be one that you could fill out.
Well, this wasn't a request for an evaluation. This was, they said, if you just write a letter saying that this patient should not be driving, they'll take the license.
Yeah.
Is that true?
That is true.
Okay.
And then I think typically they're given a 30-day, like to kind of get your things in order.
Okay.
Like, if you were told you couldn't drive, for 6 months,
yeah.
You get 30 days, and then your license is taken away.
Okay.
Yeah. And then they can, I think, go through that appeal process. But yeah, I guess the other thing, I asked my coworker, do you have any things you want me to share? And, I'm torn in saying this, but there's sometimes when people have come and I'm like, why did you even get here? You're so blatantly confused, and I'm not so if it's so obvious that you shouldn't be driving, I sometimes feel bad because they're already mad that they're told they can't drive, and then we go tell them they can't drive, and we charge them for it. They're not happy with me, because this is typically something that's not covered by insurance. So I mean, I guess if you if whoever's making the referral, if you really in your heart feel they should not, then that would be a better route to do that letter to the DOT. I mean, I don't want to throw away business, but I just, coming from a family standpoint, I've seen a lot of them where they, and even if my thought used to be that if somebody came, we could show them that maybe that they shouldn't be driving. No, if they don't quite recognize they shouldn't be driving, me showing them is not going to help. They're not going to get it. So,
Okay, thanks.
yep.
So if you have a patient that you think is not safe to drive, would you recommend that we just send them to the DOT, or do you think it would be better to have you evaluate them?
Well, if you have any concern, I mean, if you think maybe they can do on a limited basis or something like that, but if it's blatant, if they, if they're totally confused or they have peripheral neuropathy and they can't feel their feet at all, then that's just kind of an example. I would say it's probably almost better to just to proceed and notify the DOT that you're questioning that. Yeah. I mean, there's some that you can, I guess I appreciate the fact that physicians refer, because sometimes people look like they shouldn't be driving and they do really bad with me and they do stellar out on the road, which makes it really hard then. But oftentimes when they come and they're not doing well with clinic stuff, they most likely are not going to do real well out on the road. But, family members, they don't know. And I'll be the bad guy. I'll be the fall guy, because it's probably easier having sometimes us say, you really shouldn't. And we're just making recommendations back to the physician. We don't make the final say. But sometimes I think it's easier for a client to take it from us than from a daughter or son or whatever. Yeah.
Hi there. Excuse me. I represent a home care agency that is often called into these situations to provide transportation to some of these folks. And a lot of times families aren't here or nearby. Maybe they're out of state. And there's definitely some concerns about someone's ability to drive. But our ability, we're a voluntary choice for people to bring in. And so the success of what we do really hinges on that trust. And so when we're accompanying folks to doctors, and maybe some of the physicians here in the room could answer this, it's not always the best idea for us to, on their behalf in their appointment, say, oh, this person really shouldn't be driving. Could you evaluate them for this or talk to them about this? What would you recommend is the best course of action in lieu of family? Family is one thing, because you can't just divorce your family necessarily, but so that we can continue to have that trust with our clients so we can provide good care for them, is there a good way for us to, contact the physician's office in advance and let them know that there is a concern? Maybe they could talk to the patient about that at their next visit, or what do you recommend for?
That's what I would recommend, is having you let the physician's office know that you've seen some concerns. And then also, I have had some patients' families that happened through a home care agency. Somebody went on the website and found my name and called and said, my mom has had all this medical stuff. What can we do? And then I say, you talk with the physician and tell them your concerns, and then the physician can write a referral and have them come to us. Yeah.
Will the physician have to tell the patient that the family requested that? I know sometimes daughters call and they'll say, they're reluctant to do that, not knowing, not wanting to make someone mad, or
Well, when I've had people call me and say, I don't want them driving, I don't disclose that to the family or to the person. I just say, so I kind of pay it up the fat. I said, well, I read in a note that you had an accident. Is that right? And then they're like, where'd you see that at? Oh, I think it was in one of the medical notes. Kind of, I didn't point fingers on anybody. But if it's a family member, I don't disclose that, but I kind of sheepishly sort of, so what's going on? Those kind of things. But I think if you can tie in family and family, try to tie it back to the physician, say, we've concerns, I'm far away and I'm very nervous about them driving. That would be the best route to go.
Great. Yeah. Thank you.
Mm-hmm. I know I had a lot of information to pass on, so that's, the handouts have things in there. My number's on there, my email. If anybody wants to contact me, I'm more than happy to answer any questions. Okay, thank you.